Great.
Thank you, Steve.
Okay. So let me first tell you what I'm not. I'm not a healthcare professional. My background is I'm a lawyer and an industrial engineer. So I spent my career practicing law, mostly in the world of real estate, commercial corporate transactions. I was general counsel of several companies, and then I ran companies for others, sort of doing operational repair on companies. And a little over 10 years ago, I was at a inflection point in my career and decided I wanted to do something different. And this is what we decided. So we came to home care because both my parents lived up in New York. They had cancers at various times. And I have two brothers, not medical people as well. And we learned a lot, almost exclusively the hard way. I feel like if there was a mistake that could have been made, we did that. My father-in-law has had dementia for the last 17 years. Same thing. We learned it the hard way. So when we had an opportunity to do something different, my wife and I thought, we learned a lot and we could share that with people. And so that was the genesis for starting Assisting Hands. And so we're a private duty home care company. We work all over Montgomery County, PG County, from like Route 50 north till the Beltway to Laurel, and then east until Annapolis. And we work with people no matter where they are. If they're calling it home at the moment, we serve people there. And it could be in a hospital, it could be in a hotel, it could be in a private residence, an apartment, rehab, you name it. And part of our goal is education. So our major core value is helping educate people on not just home care, but how to stay healthy, how to be safe in discharging from a hospital or a rehab. And so we do a variety of talks throughout the county and in other communities to help just educate people. So that's the basis for my talk, is what I've learned. I also serve on the board of Potomac Community Village. So I know the Village movement well. I'm a huge fan and supporter of it. We all struggle with the same issues. And so that's my background. Today, what we're going to talk about is sort of aging in place and really, is it right for you, right? Because you don't have to stay in your home. You can choose to move to another home. You can choose to move to a smaller home. You can choose any one of the large, assisted living communities throughout our county, or the smaller group homes. And there's no right answer, right? It's only what is right for you at the given time you're going through it. But you should explore and understand, what do you need to be able to be successful in living at home? And so we're going to talk about your support network, timing and planning of if you're going to make a decision, the cost considerations, personality type, and then sort of health and nutrition choices, right? So those are kind of the broad-based topics that we're going to cover. So people choose to stay at home for a variety of reasons. One is memories and comfort. This is your house. You spent a lot of years making it yours. You know where everything is. You're comfortable. You know how to work the toaster. You know how the microwave works. You know where everything is. And there's comfort in that. There's also your memories. If it's the house you raised your children in, then you have all the memories of your children and the lines on the wall marking the height of your daughter as she grew, or whatever it is. Some people don't move because it's hard, right? You've accumulated 50 years worth of stuff, and now it's everywhere. And now you have a choice. You can either be the one to get rid of it, or you can leave it to your kids and let them figure it out. So my parents had two homes, and that was their choice. They left it to us to figure out. And we figured it out. It was a lot of work, because nowadays, no one wants your stuff. Trust me on this when I tell you, your kids want very little of what you have. It's just the way it is. Even those things that you feel like, what do you mean? I got this from my mother and her mother before. maybe you convince them the historical nature, but mostly their lifestyles are different. They just don't want our things. Some people are just too stubborn. They don't want to move, and they don't have any good reason for it. They don't love their house. They can't get around it. They can't get up the stairs. They're living in their family room. They sleep on the couch and they get a bird bath. And they would be so much better if they moved somewhere else, and they're just not going to do it because they don't want to. And that's fine too, as long as they recognize the choices that they've made. So some part of moving depends on kind of where do you live? Where is that house located? Now, the good news is most of you presumably are in the Bethesda area, which gives us lots of options, right? There are a ton of food delivery services, right? Whole Foods delivers, some of the other grocery stores deliver now, Giant delivers. You can get food now with Uber Eats delivered almost anywhere. I live out in River Falls, which is out near where Old Anglers is. Nothing comes out there. Now, Amazon comes out there, but and many food delivery services don't, restaurants won't. So there's a limit. Here you have less limits. Transportation options. Again, life has gotten a lot easier because of Uber and Lyft. If people know how to use it and have a smartphone, there is something called Go-Go Grandparent for those people that don't have an access to or desire to use a phone, but that's a whole nother talk I do. There are buses. Metro access is actually, everyone complains about it, but the fact is we have it. It's a great resource. It's just you can't be in a hurry. You can sign up for it. It's relatively easy to do. The problem is you do have to go down to their office, unless they've changed that, to fill out the final applications. But again, you can call. So that's important. Doctors, again, Bethesda, we're really lucky. We've got Suburban around the corner. We've got the Fernwood doctor conglomerate where there's just about every doctor in the world there. We're not that far from Georgetown. So again, we're very lucky in that need of having doctors close by. I have friends that have moved out to the Eastern Shore to Cambridge. They love it there, except for when they get sick. Then they have to come here because none of their doctors are there. And they don't have a good medical network there for any specialties. So having doctors where you need them is really important. Okay. And then your neighbors, right? I encourage people to get to know your neighbors. So, it's remarkable to me. We moved into our house 26 years ago. We were the youngsters, right? We walked our kids up to the bus. We met a lot of families that way. And now we're the old people. But we still, just last week, we had a neighborhood block party and we invited all of the neighbors that are on our street down to our house for barbecue. Why? Well, we want to know them. We want them to know us so that we keep connected to our community and know who's out there. And hopefully, if we need a little hand, we could give them a call and one of them will come over and help us out if we should get there. Okay. And there are a lot of mobile options today. Doctors will come to your house today. There are mobile doctors, mobile nurse practitioners. There are mobile dentists that will come and do cleanings and extractions. There are mobile podiatrists that will come and address foot care. Pharmacies will deliver and food delivers. If you need an x-ray, there are mobile x-ray people that will come. There are mobile phlebotomists. So pretty much if you need something in the world of medicine, at least at the general level, it's deliverable to your house by a visit from a physician who can order labs to come to your house. So again, Bethesda has a tremendous variety of those things. And then you're going to look at your home safety, right? Because you have got to look at your house to make sure it is ready for you to age in place. Right now, there is a ton of adaptive devices that you can get to make things easier. Light switches that aren't the little thin ones that are bigger so you can just hit them, or that go on when you walk into a room now, or you can have Alexa just talk your lights on. So again, we'll get into more detail. And then there's universal design things that you can do to put in ramps and to do other things to make, a no threshold shower. So you can do all those things in your existing home. It's just they're expensive, some of them, some not. So that's basically what we're going to cover. And so the support network, look, family and friends are your biggest. And you already got the next one on my list, the village, right? What a great resource. So really, when you think about the village movement, it's nothing more than the way people used to live 50 years ago, where we all knew our neighbors, and when you needed something, you called your neighbor. Now, no one wants to bother their neighbor. You call your neighbor to see if they're home. You don't just knock on the door. Society has changed a bit. If you need to get a cup of sugar from a neighbor, you don't go knock on the door. You text them and say, "Hey, are you home? I'd like borrow a cup of sugar." So it's different, but the village helps bring that back to the way it was. The village is here to help, to create social opportunities, and to create friendly visits and other things. Faith-based organizations are another way to keep connected to a support network. If you are Catholic, any number of churches have a parish nurse assigned. So you can ask your church if there is a parish nurse. Oftentimes they do, and they will help with senior issues. Oftentimes, if there's more than one minister or priest, someone may be assigned to working with the senior community. So again, resources. The sisterhood and brotherhood are great opportunities to get together and meet, chit chat, keep connected. So you can also get professionals to help in some way, right? You can get geriatric care managers. They're called aging life care professionals. They're really kind of like the quarterbacks for aging. So they are professionals. They bill by the hour. I don't know what the hourly rate is, north of $150 an hour. And you use them for as much or as little as you need them. But they're the ones that when you need a doctor, they're connected to who are the doctors for diabetes or for kidney issues, or even if you need a neurologist, something, they're the ones that keep on top of that. If you are thinking about moving, they're the ones that will tell you about communities. If you're thinking about home care, they often have recommendations about home care companies. So they're a great source, and they all do it a little bit differently. Some have senior programs where they just gather information and then they check in with you maybe once a year, just so that if you need them, they've got an up-to-date plan about you and your present needs. One of the problems that happens is that as we age, our doctors all retire. And now you need a new doctor just at the time when you're now starting to need that guy on a regular basis or that woman, and they've retired. So a lot of times, if you have kids in the area, they just use your kid's doctor. Well, the problem is your kid's doctor is used to dealing with 50 and 60-year-olds, and they don't necessarily understand all the nuances of an 80-year-old patient. Medicine is very different for someone with an 80-year-old client than a younger person, because older folks are more impacted by medication, so may need smaller doses. They have different types of needs than our children's doctors who might be in their 20s, 30s, or 40s. So again, they help with that. There are daily money managers. My mother-in-law lives down in Florida, and she has a money manager, person who comes in once a month and just helps her go through her bills and to make sure she doesn't double pay somebody, to make sure things are set up properly, to make sure the bills make sense, that she's not getting a $2,000 water bill from the water company because they made a mistake or whatever. They can help oftentimes with financial advisor as a coordinator, and they can help oftentimes with fighting with insurance companies over bills and non-payments. There's OT and PT that will come to the house. Now, you can get it through skilled services, where a doctor orders in-home OT and PT, or you can get it and pay it privately. There are private pay physical therapists and personal trainers that will come to your house and provide that same care, not covered by your insurance. So again, they're all out there. There are a number of great adult day programs. So especially for folks with cognitive impairment, there's several of them. There's the Friends Club, there's Kensington Club, Ingleside at King Farm has a great group for people with dementia. There's one in Silver Spring for a medical day program. So if somebody needs medical assistance or assistance with toileting and things like that, there are programs for that as well. There are transportation services like Uber and Lyft, and even if you need somebody to take you when you're wheelchair bound, there are services that will do that. They're not inexpensive, but they will pick you up. They will take you to a doctor appointment. Depending on the length of the appointment, they will wait. They will bring you back. And then there's home care, right? And you can get professional care in a variety of ways, and I'll just touch on each of the ways a little bit. First way is direct hire, right? The person who's been cleaning your house, for 40 years, you can ask her, hey, do you mind, coming an extra day and helping me personally? And you can do that, right? You can hear from a friend. Oh, my mom just had somebody and she just passed, and I've got this great caregiver. And you can hire people that way. Okay, now, there's upsides and downsides to hiring people, finding them. Before this call, I was on the phone with someone who just hired 2 caregivers privately. But she wasn't so sure that she had done the right thing. She just wanted to explore with me what it would look like to hire through an agency. So when you hire directly, one of the things that you get is hopefully somebody. You could go through care.com. It's just a marketplace. They're not vetting anybody. It's just a place to find a human. I don't recommend them because they're not vetting them. So if you know somebody that had a good experience, sometimes that's great. So then the question becomes, how many hours a day are they in your home and how many people do you need? But now you're their employer. So if things don't go right, you're hiring and firing them. If they get sick, you got no one to cover. If you're doing it the right way, either you're 1099ing them or you're hiring them as employees. The conversation I had with this woman is she has these people working 50 hours a week for them, and they're paying them as 1099 contractors. Well, I'm a lawyer, but I don't practice that kind of law. But I'm going to tell you that if somebody is working in your home 50 hours a week, they're not an independent contractor. They're your employee. Now, maybe some lawyer would tell you different, and maybe you're willing to take that risk. That's a personal thing. But I think if you're controlling their schedule and what they do, you meet the indicia of being an employer, which means you have to withhold taxes for them, and you have to cover them for workers' comp insurance. So this family had a 97-year-old aunt. I think they're not so worried that the federal government's going to come after the 97-year-old aunt for not withholding taxes. Fair enough. But what happens when that private caregiver falls and hurt themselves in the house? And they don't have insurance because many caregivers can't afford insurance. Well, that's a workers' comp claim. They're going to claim that you were acting as their employer and you don't have insurance for them. Even if you think they were an independent contractor, when it comes to protecting workers, they're going to find in favor of the worker almost every time. So I would encourage anybody that's going to go hire a private caregiver to call your homeowner's insurance and ask them, what does it cost to get a rider to cover workers' comp? It's not that much. I did it many, many years ago when we had to have a nanny live with us for a year. And it cost us $400 to get it added to our policy. It wasn't a big deal. I'm sure it's a lot more now because this was 20 years ago. But I encourage you to explore those things. Then there are what called registries. Now, registries sound like agencies, which is what my company is. Registries are providing you a vetted caregiver, but they otherwise do not supervise them. And they're offering you them as independent contractors, but they're significantly less money. So typically a private caregiver these days is somewhere around $25 to $27 an hour for a private that you're going to hire. Could be more. These people hired someone at 30. That's high. But, they were someone they knew. That's what they said. They didn't want to argue over price. So, but it's typically 25 to 27. If you hire through a registry, they're vetting a person. They're ensuring that they're licensed as a certified nurse aide. And they get a fee for effectively placing that person in your home. And they're advising you as to what the rate would be, what they think you should offer to pay them. But it's up to you to cut the deal with them. And then they get paid a commission for doing that on a weekly basis based upon per hour. So typically registries, I'm going to say, are around $29 to $30 an hour for what I'll call a 10 to 12 hour shift. And then there are agencies. That's what assisting hands is. And so agencies cost a lot more because we're providing a basket of services that these others don't provide. So when you hire an agency, whether it's mine or one of the 250 other home care companies in Montgomery County, you're getting someone that has vetted these people, ensured they're certified nurse aides, licensed with the Maryland Board of Nursing, and CNAs are the same people that work in hospitals and rehabs. They just do it in a home setting, okay? We make sure they pay their taxes. We cover them for workers' comp insurance and general liability in case they broke something or stole something in your home. They are supervised by one of our members of our nursing team. And if there's an issue and you don't like them, you call our team and we replace them. We don't care why you don't like them. It's your house, your rules. You don't like them, we replace them. And we will periodically supervise and check in to make sure we're doing the right thing. If someone gets sick, we will automatically find a replacement. So that's what you get for this basket of services. Every home care company is different, so I'm not going to speak to other people because I don't know how they work. But we have someone who answers our phone 24 hours a day that works for our company, that is awake at night answering the phone. So they always know what's going on with our team of people. And so our rates range anywhere from $33 an hour. So as I said, 25 to 27, 29 to 30, 33 for home care with an agency for 10 to 12 hours. If we're less than that, then the rates go up. So we do 4-hour shifts as a minimum, and the rates there are around $40 an hour. Why is it so much more? Because we have to pay caregivers a lot more money to get them to take these short shifts because they don't really want to do it. So part of that gets passed on to the consumer. So that's the story. That's the difference between them all. And again, there's no right or wrong answer. We work with people that have some privates that they know and then ask us to fill in the rest because maybe they have a trusted caregiver or a trusted family member or a trusted housekeeper that may work for them 3 days a week for 6 hours, but they need help on those other 2 days or the other 4 days, and then they hire us. We don't care at all. We work with any sort of need that you have to match what your needs are. And so you have to decide, what do you value, right? It's very expensive for home care. If you get to the point where you need 24/7 care with an agency like mine, it's going to be costing you around $20,000 to $21,000 a month. That's an insane amount of money. We have any number of clients that pay that every month. Why? Because they have made the decision that staying at home is what's most important to them, and they have the money and resources to do it, or they have long-term care insurance, and we'll get to that in a minute. So you have to evaluate what's best for you, and then figure out if you think you can't ultimately afford it, what's the time you may need to move to make a different decision? Now, not everybody needs 24/7 care, right? Because most people don't need a lot of help at night, or they may not need to get up at night. They may not need it 7 days a week. They may have family members, loved ones that can pitch in. So again, all of those are things to think about and consider as how you make your decision. Then, timing and planning. Planning, I would say earlier the better. Don't be an ostrich. We're all getting older, and this is all going to impact us. Now, most of us hope that we are in our 90s, late 90s, maybe hundreds, had just finished running a marathon or taking a river cruise, go to sleep after having the most amazing meal of your life and don't wake up. That's what everyone wants. And there are some people that get that. And I don't know what percentage of people get that death as opposed to the one that we deal with every day where people aren't happy and they're struggling. Okay. But recognize that you don't know where you're going to be in that percentage of people. So plan for the worst and hope for the best. Timing. When do you make timing decisions? Look, timing is very much dependent. So if you think, ultimately I can't afford to live at home or I want to explore assisted living communities, fine. But be realistic, understand your needs. And there is a debate ongoing always between if someone is cognitively or physically impaired, do you do it early or do you wait until it's late? And I don't know the answer, right? I will tell you that we've seen both. We've seen clients wait until mom or dad didn't actually know where they lived at all before they moved them. And that's still really hard because home becomes the anchor of someone with a cognitive impairment. And moving them is hurtful. It definitely impacts people, and you just have to figure out how do you minimize that impact. Okay. If you do it early and you move somewhere early, then, is this the lifestyle you want to live? Right. So there's lots of benefits. There's a new assisted living community opening up almost every month here. And some have super fancy bells and whistles, and some are, sort of more moderate in what they offer. And whether it's for you or for your loved ones, think about who you are, right? And your wants and needs. Because if you go to any of these communities, they look beautiful. Some of them look like Ritz-Carltons. I mean, they're gorgeous. Their food is 5-star. They're amazing. They have an extensive wine list. They've got a free open bar. And they've got 250 activities every single day that you could take advantage of. But guess what? If you or your loved one is reclusive and likes nothing better than sitting quietly in their favorite chair reading a book, why are you going to move them to this place that they're going to be miserable? Because there's going to be all these people they have to interact with. They're never going to leave their apartment. And now you're paying for all this stuff that you don't need. So match the place to the personality of the individual. Okay? Be inclusive in your thinking. Now, I know that your kids don't actually want to know that you're getting older until they think that you're not capable, and then they want to control everything about our lives. Okay? But in large part, that's because we didn't take them along for the ride, whether they wanted it or not. So I always encourage people, tell your family your wishes. Let them know what you want. If you don't want to move to assisted living, have an honest and frank conversation about that. But that also includes having a conversation about where's the money coming from, right? Because your kids can only do what you want them to do. One, if they know it, and two, if you've left them with the resources to make that a reality. So it is important to have the conversation, and even amongst you and your spouse, have the conversation about how each of you would want to be treated in the event that you became physically or mentally disabled, right? And it's a hard call. Like my parents made the decision they wanted to stay at home. They lived in an apartment in New York City. They could afford it. They had 24/7 care. But my dad, when my mom got sick first, instantly got 24/7 care because he was not a caregiver. He had no idea how to do that. When I was a teenager, he actually walked into my mother's bedroom while I was talking to her with a pot of water to ask if it was boiling. This was a man that ran a division of a very large company and had no clue if water was boiling. I mean, literally clueless when it came to anything related to the home. And he knew he was not up to the task of caring for my mom. And that was the right decision for them. Even though they had a person in their home in a 2-bedroom apartment in New York City, and it created a little intrusion to always have a person around, but it was the right decision for them. What's the right decision for you? Don't know. Don't even know if you know, but give it some thought. Get help with a plan, right? There are all sorts of financial advisor and healthcare professionals like geriatric care managers that can help you understand the likely costs of things as we come down the road. And I'll give you a little bit about cost considerations as you pick and choose. So build a plan and stick to the plan, but be prepared for the curveball to come up with a new plan. Because whatever you think is going to be the plan is probably not going to be where you end up. Maybe it is, maybe not. You just don't know, right? It depends on so many factors about how you age and how your people around you age and their ability to help you as time goes on. So, timing is important. Earlier, the better. If you're anally retentive, you're never going to get it right, and you can't solve for every problem because we don't even know what problem's going to come up right now, right? No matter what we think, it's going to be something new, right? So let's talk a little bit about cost considerations, right? You can live at home. You know kind of what the costs are. You have your house. You can minimize the expenses of the house by shutting off the heat in other rooms, you can do changes to your house to make it easier to live in, right? So you can get Alexa to turn on all the lights, to turn on the heat, to do all sorts of stuff. You can have an app on your phone that will do the same thing. You can get food delivery services that will deliver both prepared and unprepared meals for you to make, right? So you can continue to live at home if you want, and you pretty much know the cost. If you're going to bring in home care, again, I've already told you what that is. It's going to range depending on your needs, anywhere from $33 an hour up to $40 to $42 an hour. If you have long-term care insurance, you can use that to help defray the cost of home care. If you have short-term or long-term disability, oftentimes those policies can be used to defray the cost. Medicare does not cover what we do, does not cover custodial care, home care. Medicare covers OT, PT, speech, wound care. So if you end up in the hospital and then you go to a rehab and then you come home, you will typically get 6 weeks of rehab, OT or PT, where someone will come to your house once or twice a week. There is a very, very tiny component of home care where an aide will come to your house maybe once or twice a week for an hour to do a service. Help you take a bath, change the bed sheets, something like that. It's very limited. Okay. Hospice, same thing. Very limited. Hospice is great. I recommend people understand hospice and avail themselves of it when the time is right. Don't wait till the end because they give a lot of things like hospital beds, like incontinence supplies, like medicine management, like bereavement assistance, all sorts of things. But they don't do what we do either. They don't have an aide who will come for a substantial period of time to take the load off a loved one. They again have someone who'll come once or twice a week to do a service. Okay. So you can go to, there are a lot of independent living communities out there nowadays. Leisure World, Ingleside has, Ingleside of King Farm has an independent side. There's a variety of them out there. Whatever it's going to be, Grandview is a Riderwood, is an Erickson community. It's like Riderwood out in Silver Spring. They will have an independent community. Each one of them is different. Some you have to buy in, like Fox Hill. They have an independent community. You have to buy a unit there, and they're around 1.25, 1.4 for a one bedroom on up. Ingleside, same thing. You have to buy in. I don't know what the rates are there. So you have to evaluate, do you want to buy in? The thought is, what they'll sell you is, this is the last place you have to ever go. Because if you go through the stages of independent, and then you need assisted living, and then you need memory care, and then you need skilled nursing, you can do that all within the community. The problem is, no one wants to move from the first place they moved to. That's their new home. They don't want to go through the system, right? So you end up in independent living in Ingleside, and you hire someone like us to provide the home care to keep you there because you don't want to move to memory care or to assisted living. So just, again, think about that as you think about the progression. Okay, so those places, it's hard to say. Each one is different. They have oftentimes an initiation fee. And then it's like a country club. You pay a monthly fee for meals and entertainment and other activities. And then you have assisted living. And assisted living typically are these bigger communities. Some have the whole progression, and those are called CCRCs, Continuing Care Retirement Communities. Okay? Then there are others like Brightview, Woodmont, which is just assisted living and memory care. Okay, so you can't live independent there. They have assisted living. And assisted living ranges nowadays anywhere from around $11,000 a month on the low end, up to somewhere at about $18,000 a month at the high end for an individual. A little bit more for a couple. Okay? Now, assisted living is a little bit of a misnomer because you're not getting one-on-one personal assistance. You're getting a little bit more help. So they provide meals. They provide typically medicine administration. They'll provide laundry service, maid service, those kinds of things. And they may, depending on the package you buy, provide some level of assistance, where they may come in the morning and help somebody get dressed. They may come in the afternoon to help with lunch, or they may come in the evening to help with bedtime, or they may only have somebody comes in twice a week to help you with a shower. So you buy the level of many of these places, the package of services that you want, which increases the base price, right? So the 11 grand can oftentimes include a basket of those services. So again, each one is different, each manage it differently. You know, there's one I was thinking of, I forgot to mention, 5-Star on Connecticut Avenue. I think you all are probably familiar with it. That's an independent living community. So they offer meals, they offer all these things. You pay rent, $5,000 a month. And then if you need help, you hire private duty companies to provide that extra service. Okay. Ring House, similar thing. Independent community, provides meals, and then you can buy up if you need the added services. So each one is a little bit different. There's no right or wrong. They're all lovely. But make sure you realistically understand and set your expectations properly. Because it is not care around the clock. It is not, if mom is tending to be in her room, they are not coming to get her out of there. They're going to open the door and say, hey, Mrs. So-and-so, would you like to have, we've got bingo going on. And mom goes, yeah, nah. And mom's sitting in her room. So again, make sure you understand you and your loved one's needs to make sure you're making decisions about the place that you want them to go to. Now, the opposite to the big, huge assisted livings are smaller group homes. Montgomery County or Maryland has a framework where they have 8-bed group homes. And I like these a lot. They're typically smaller. They're typically a little less expensive. So maybe starting at around $9,000. Some are even less, not in Bethesda and Potomac, but in Silver Spring and Wheaton. There are some that are in the $5,000 or $6,000 a month range. Here they're in the 9 to 11 range as well. But what I like about them is it's 2 aides for 8 residents, where in an assisted living community, it's typically 1 aide for every 8 to 12 residents. So the coverage is a lot less. At night, they typically have 1 aide for the 8 residents. And so they have group communal dining, so there's always people to eat with. Their food's pretty good. It's not the 5-star chef with the wine list thing, but it's pretty good. And they offer activities, but not the 150 activities that these assisted living communities offer. They offer a pared down version. So I like them better because I think there's more attention to detail. They get to know your loved one better. The downside to them is it's 8 people. And if your mom hates the other 7 people, or you hate the other 7 people, then you're going to hear about it, or you're going to be miserable. Or if you're in a big, huge community, it's the law of large numbers. Somebody's going to be a good fit, right? So that's the thing. I like small group homes. What I really like is I want to live at home. That's what I want, which is why I started a home care company. I'm hedging my bets. I'm hoping that when I need it, I still own the company, or if not, I'm going to, as part of the sale, somebody's going to have to give me care so I can stay at home. But, so that's the thing. As I said, living at home can be really expensive if you ultimately get to 24/7 care. The crossover point, generally speaking, is roughly about 9 to 10 hours a day. So taking account out the cost of the housing, the fact that you're maintaining a home, dollar for dollar, it's roughly 9 to 10 hours a day is equal to what it costs per month in an assisted living community. So you can do the math on your own. Most people, we care for a lot of people that never get to need more than, 6 to 8 hours a day. We do have 12-hour-a-day cases, and we do have 24/7 cases. And we do have live-in, which is where you have a caregiver who lives in 3 days a week or 4 days a week, and they alternate. And that's a little less expensive. Okay. So payment options for some of this stuff. Long-term care insurance covers all of it. There are various elimination periods and things like that. You have to meet those. Medicaid does cover both home care and living, but you have to qualify for Medicaid, which means you effectively have to have no assets or very minimal assets. Unfortunately, the quality of care you get in Medicaid homes is not as good as you would get in an assisted living community. The reason is they're not getting $11,000 a month to take care of you. Medicaid's paying them $5,000 or whatever it is. And it's so they're doing as much as they can with less. Okay, it's a problem. There are a couple of assisted living communities. I can think of one, Brook Grove used to, and Asbury Methodist. If you move into one of their communities and then you subsequently run out of money, they will not ask you to leave. They will keep you there. They'll move you to their Medicaid area, but you can continue to stay in their community and be served by them. So that is something to file away if you think you might need that as a potential resource down the road. Because if you're in an assisted living and you run out of money, bye-bye, right? These are for-profit entities. They're not, they're not charitable entities. You're going to have to leave. Veterans benefits. So If you're a veteran, there is a home and community-based service program which will provide up to 40 hours of care a week paid for by the VA. It has to be you. You have to be a veteran. There are certain classes of veterans that qualify versus don't, and a certain level of need, but it's not financial based. So we can give you more information on that if you know somebody that's a veteran, or we can help you navigate the system to try to find out. And then there's a program called ARC of Montgomery County, which I encourage everyone to write down if you are a couple or live with someone, because they will subsidize the cost of our care. So they will subsidize 140 hours per year of care, and it's not financial based, it's need based. So you have to be living together. So it's not for singles. You don't have to be married, but two people have to be living together. One person has a need, and you have to live in Montgomery County, and then you qualify for it. It's a great program. What they will do is they will subsidize $33 an hour up to 140 hours of the care we provide. So if it's a 12-hour shift, then they're covering all of it. If it's a 4-hour shift, then you're paying $7 an hour for the cost of care. So it's a great deal. There are certain preferred providers that are in the consortium of ARC, it's called. We are in the consortium. There are many others. I don't know how many, and not hundreds, but probably at least a half dozen that are also able to take money through the ARC of Montgomery County. I recommend looking at it. It takes about a month to get approved through their program. They do run out of money cyclically. So their fiscal year is July 1 to June 30. So pretty much by March, they won't take on any more new clients until July 1, because they will have committed all their funds. So but think about that, but that's a good thing. The county is trying a number of other options, the Golden Girls kind of options, where they're brokering roommates to get together, and live together. So those are the other options that I'm aware of right now. Last thing is to think about who you are as a person. I'll cover this in a few minutes so we have some time left. Are you outgoing? Are you active? Or are you an introvert? If you're a truly outgoing, chatty person who thrives off of people, well, maybe aging at home ultimately isn't the best for you, unless you have a strong friend and social network. Maybe moving to a community would better serve you. But if you're a quiet person who likes nothing better than sitting quietly reading a book, being by themselves, maybe you would be better off staying at home until it becomes not economically feasible. Think about, do you easily join groups, or is it hard? One of the problems that oftentimes happens in these large groups, group communities, more for the women than the men, is the mean girl syndrome. Okay, so men are clueless. We don't know that other people are talking about us or don't like us, or maybe we don't care. But women, it's a thing, and not in every one of them, but there are clusters where you can be ostracized when you become that person that isn't quite on your A game anymore. So again, you got to look for that. You got to ask questions about that, because that's important. Then think about the medical conditions you have. If you have vision or hearing loss, moving to a large community, which has got lots of noise, big dining areas, or you have to navigate hallways, that's going to be really hard. In your home, you know where your toaster is. You know how many steps to your bedroom and to the bathroom. So again, think about those things. Do you have diabetes? Is it managed or unmanaged? Can you manage it at home through proper meals? Then dementia. Again, same thing. Dementia is hard on the spouse of the person with dementia, because they are now taking care of what oftentimes becomes a child again. And that takes a wear and tear on a person. Okay. So someone asked, Scott asked, I didn't talk about nursing homes. I didn't really, Scott, because today nursing homes, that's the last continuum of care. That is really where you're going to end your life. And most people don't go to them nowadays. They don't want to go to them. It's only when you are really with in unmanaged pain or unmanaged situations, if you have feeding tubes, if you have other kinds of ventilators and things like that, where it's complex medical care, wounds that can't heal, that you end up in what was then known as the nursing home. So yes, it's part of the continuum of care. No one wants to go there. I mean, I can give you, the names of some of them as well if anyone is interested. Someone did ask about meal prep. Yes, private duty home care. We make meals for people all the time. That's part of what we do. Now, we are not gourmet cooks, but our aides all know how to cook and they know how to make basic foods. So that is part of what we often get asked to do. Now, we're not meal preppers. So if you want an aide to come in on a Monday morning and make dinners for the next 5 nights, no, that's a chef. That's not our aides. Okay. Couple other things. I would say make sure you stay fit, exercise, exercise, exercise. Do what you can do. Walking is great. Tai Chi, yoga, resistance training has been proven to be critically important as we age, not just for folks with osteopenia and osteoporosis, for everybody. Weight-bearing work matters. So I would stick to doing those things. And last thing before I'll take questions, if you remember nothing else, which is why I save this till the end, drink water, drink water, drink water. Hydration is the most important thing that you can do. The significant number of falls happen in the home, and they happen in the home because people were dehydrated, they stood up too quickly, their blood pressure dropped, and they fell like a stone, hit their head, and that became that. So stay hydrated. Coffee and alcohol, Diet Cokes, that's not hydration. That's entertainment. Okay. Stay entertained, but drink water. Okay. For those people that hate the taste of water, like my father-in-law, he's 90, never drank water. He drank beer and he drank coffee. That's what he drank, right? He worked for NASA down in Florida, and they drank coffee all day long. And then they came home and they had a couple of beers. That's it. So we get him flavored water. We in America are incredibly lucky because we have a whole aisle of nothing but flavored water. Somewhere in there, there's watermelon water. There's lemon water that somebody's going to taste and go, this is good. I like it. Gatorade, look, it's great, but it's super sweet. I don't recommend it. If you want to get electrolytes, buy electrolyte tablets. That stuff has got a lot of sugar in it. But look, it's healthy. It's good for you. It's got hydration. But so does Pedialyte. The things we gave our kids or your children gave their kids doesn't have all the sugar, but it's got all the same electrolytes. And try to eat healthy foods. But again, I'm going to tell you all, if you're in your 80s and you like ice cream, eat ice cream. It's not going to be the thing that kills you unless you choke on it, right? It's enjoy your life. You're here for a reason. Living longer isn't the goal. Living well is the goal. So do the things that you love to live well. Eat the things you want. When your kid tells you, Mom, what do you mean you're drinking another Diet Coke? You can safely say, honey, I'm 90 years old and I like Diet Coke. And if Diet Coke is the last drink I have, I am a happy woman. And just let it be. Okay. So any questions? That's pretty much the end of my formal presentation.
Thank you,
but,
Steve. Thanks so
yeah,
much.
happy to answer any questions.
Great. I'm just going to double check in the chat here. And thank you also, I should have said at the beginning, for your work with Potomac Community Village. And of course, that's where we became colleagues and all your great work there. You answered most of them. I had put in a question, which you sort of answered, which is, if you know about the state of ADUs in Montgomery County, this is way outside the bailiwick of what you were talking about, but it seems like such a possible good option for people who do want some income while they're alone, but then can have a live-in aid later.
Well, and so I have a woman I work with actually, and she lives in a nanny pod,
Yeah.
right? So she lived up in New Jersey. Her kids live down here. They built accessory dwelling unit is an ADU. They built a little teeny house in their backyard for her, and she lives in her little house. But she has access to her grandkids all the time. They have dinners together, but she's living in a pretty much a self-contained separate place that she doesn't really need to involve herself in their life. A lot of people do that. They may choose to rent out, the floor of their house. Like I have a walkout basement. Theoretically, I could move down there and try to convince one of my kids to move into the house upstairs and we could live downstairs. Now, I've been told by all three kids that's not an option. They're happy to have the house, just not us living in the basement.
We have members who've done that. So yeah, it's something that I'm just following individually, and hopefully it'll be helpful for village members in the future. So you answered the questions that were in the chat, but people who are unmuted, feel free to unmute, even though we're at 3. Steve can stay longer and answer.
I can stay longer.
Thanks for coming.
Anything I didn't cover?
I have a question. Before I ask my cardiologist, you probably have more contact with the people in my question than probably any cardiologist. And that's if people are dehydrated, does their blood pressure go up? And with hydration, does their blood pressure go down?
You know what? That's a good question, and I actually don't know the answer to that.
It might be something just to follow in your patients. If you ever you can have that opportunity through your nursing groups or whatever.
Yeah.
I'm a physician. I have to ask that to my cardiologist. I don't really know myself. But since you had contact with so many people and you are aware of dehydration, it's very obvious how bad that problem is in older people. Okay, just wondered.
It's a really good question. I'm not sure I know the answer. I do know that failing to move and not drinking enough does cause your blood to pool and get sort of thick and sluggish. So, but I don't know if it raises and lowers blood pressure. That's a really good question.
Thanks, Bob. Okay, let's see. There's
Dr. Google has said it can do both.
That's great. Anybody else? Thanks for coming. I'm going to stop the recording now, but we will have that. I can get that to you from the village, and I'll put my email in the chat again.